Welcome to this meeting of the Social Work Services Committee, 10th of June 2014. Before we start, I'd like to remind everyone present this meeting will be recorded and the recording will subsequently be available for public listening. Apparently the screens aren't working and you don't need to use your cards. Have any apologies?
Chairman, apologies from Councillor Karen Carruthers and Dennis Mayo. Councillors Ian Dick and Gail McGregor are not present at the start of the meeting. There are 15 members present.
Councillor Ferguson.
Just information to share that Councillor Dick's running late. He'll be here shortly.
She was in, yeah. No.
Are there any declarations of interest? None. We'll move to item 3, the minutes of the meeting of the 17th of April. Right. Agreed? Councillor Carruthers?
Thanks, Chairman. I'm not going to bring up matters arising here, but obviously there was a decision made at item 6. Will we be looking at that later on in this today or not? Which was appointment to outside bodies and so on in item 7 as well, I think.
Chairman, if I may, we're not looking at that item today, Councillor Carruthers. That'll be a matter for full council on the 26th.
Happy with the minutes? Thank you, Gail. I'll say that again. Item 4, Interim Chief Social Work Officer's End-of-Year Assessment of Business Plan Performance. The report will be presented by Heather Collington.
Okay, this is the end-of-year report, which we're asking you to review the overall summary of performance for the service. Sorry. That better? To review the overall performance of the service over the last year, but also to scrutinise the report, and particularly in terms of the items contained in the appendices, which show our exceptions around both KPIs and also projects. Okay, you'll note that we have 29 indicators within the report, and of that, 15 are on track. 3 of them we haven't met the target, but the difference is within acceptable limits, and we've got 9 where the target was not met and therefore was outside acceptable limits. The exception report includes all of those ones, but also includes some of the ones that are on track, so that you can see where we're actually exceeding the target, to give that sort of view of right across the service. There is one data only indicator, which is in terms of the numbers around home care, that we report as a data item as opposed to an indicator in terms of performance. And there's also another indicator, which is one of the corporate indicators, which is reported every 2 years and therefore is not included in this report, is due for reporting next year. Just in terms of a couple of key issues really to bring to your attention, you'll know that in terms of the strategic objectives within social work services, that we have included quite clearly a move towards early intervention and prevention, really. And just to sort of note our progress, probably on a couple of different indicators that I think in terms of trend is really helpful around that. One of them is in terms of the continued reduction in the number of children that we refer to the reporter, which is continuing to come down really well. And the other one probably is in terms of our progress in terms of telecare, which is again starting to improve. Still a way to go on that one in terms of embedding that, but in terms of sort of working towards and that trend towards more early intervention and prevention, those are sort of really quite important. The other one to note probably is the work around SDS implementation and the self-assessments. You'll see that we haven't quite met the target on that one, but in terms of our progress around the implementation of the Act, there's been a lot of work going on to embed that. So in a sense, that explains why we've in a sense had a little bit of a stop-start on that, and we would expect that now as the systems roll out over the summer for that to come back up again towards the end of the year and begin to see that making real progress. In terms of at the last committee, I reported to you in terms of our overall performance in terms of external scrutiny and inspections, and we've included that in terms of our end-of-year report and the progress being made there in relation to the regulated services within the service, quite distinct from, as you know, from the strategic inspections of both children and adult services, but nonetheless worthy of note. The detail then of each of the indicators is included in the appendices, and I'm more than happy to take any questions you might have.
Councillor McKay.
Thanks, Chair. I'm kind of concerned that it's on page 7 actually, on personal development reports. I'm concerned that the number of people that's not filling them in, albeit we're over 70%, but I think we should be a lot closer to 100% in that sort of feeling, if you don't mind.
Yes, this is an area that we've been having a look at over the last number of months, because we've been trying to push forward in the service the completion of PDRs on a regular basis, and we're about to go and do another push through on that. Sometimes it's not that they haven't been done, it's maybe that they haven't been logged on the system timely enough in terms of the report. So what we're trying to look at is making sure that we've covered everything. We're making sure that we've also covered, the change between leavers and starters, and those people who would be due to have a PDR and those who weren't. So we would expect that to continue to progress, and we'll look at putting some quite specific action in terms of supporting that.
Thanks, Chair. I think it's important that we indicate that we would like to see this sort of thing done. If it's just left to yourselves, sometimes we could slip even more, but thanks very much for that.
Councillor Syme.
Thanks, Chair. Just on page 12 of the KPI on reduction in the percentage of children looked after away from home who have had 3 or more placements. I just wonder how we get to this, because we could have a young person or a child that's had 3 placements because initially they go in a short term, then they go to a placement that's more suitable, and then they carry on to a placement that's more suitable. Or we could have a child that's had 3 disruptive placements. So it's not really a true reflection. And there are some of these where there's actually no concerns, it's just an actual progression and how been looked after. Could you explain a wee bit of that to me, please?
Yes, absolutely. I think this is one of the Scottish Government indicators that we need to report on, and therefore what you're looking at is that although if you look in the exception report, it explains that although the number of children overall has reduced, then of course the percentage then of those who've had 3 or more placements looks as if it's going up. So there's a difference there just in terms of overall numbers and the percentage we're actually working with. But I think what's really clear about that is it's really important to understand the reasons why. It's not always a negative reason why a child has had to be moved. We do have to respond to circumstances. It may be, as you're bringing a child through in a crisis situation, there might be a very short-term placement followed by a placement which is then followed by a move on to permanency. So you can see why. And if a child comes through, say, at 4 or 5, already having had 2 or 3 placements, then you can see that won't shift then for the rest of their career, in terms of their looked after time. So that until they then leave the looked after system, they will always appear then as having had, 2, 3 or more placements. So we can't actually shift it once it's actually happened. And that's where the explanation around this indicator is absolutely really important, because there's a lot of work going on in the service in order to make sure that children have as few placements as possible, and really recognising that bit about best practice would suggest, that we minimise the number of placements, but we have to accept that there will always be occasions when, for whatever reason, it is necessary to move a child on, and therefore that will be reflected in this indicator.
Councillor Carruthers.
Thanks. Thank you, Chairman. Just couple of questions. Sickness and absence, just in regards to that, how do we actually compare across Scotland? I was thinking as much as anything, please, Heather. And homelessness, could you just tell us how we've got to where we are today, please, from where we were?
Okay, I'm not sure that I can fully answer your first question in terms of how we compare against Scotland, because at the minute our comparisons are within the council, but we can certainly go away and look to see how other social work services perform in relation to sickness absence across the county, and we can bring that information back to you.
I mean, that's okay. The question I would ask, and rather than that, is how does this whole report compare to other council social work departments across Scotland? Not just the sickness and absence, then I'll take it as the whole report. How does that compare? Because we're about a third out with our parameters. We're in the red, so to speak. I just want to see how that reflects across the rest of the social work departments in Scotland. Okay,
apologies, I misunderstood your question. Again, we haven't compared the whole report because, of course, each social work service will report on different KPIs. But what we do have is through the Solace benchmarking, we have some reports in terms of key areas whereby we can really easily compare against Scotland. So it may be that what we need to do is put some of that together for you so that you can see that. And we might need to think about, does that come back as a separate report or whether that comes back maybe in the next 6 monthly report. But we can certainly bring that in. And look at how we do it. But I'd need probably advice from governance as to when that would come back as an actual report.
Okay, thanks for that. Just see the homelessness side. From where we are now, where we've come from, it's deteriorating as we go forward. How is that actually happening, please?
There are a number of different areas in the homelessness one that we picked up over the last, even if you look back at last year's end of year report, were there in terms of the temporary assessments that are still shown as red. So the two ones that you've got still shown as red were the same ones that were red previously. And part of the explanation and the issues about performance in terms of homelessness are in part about some of the shifts around that more sort of strategic approach, the housing options approach, whereby looking very much at how do you look at the whole person and include other services as well as just sort of the homelessness response. So I know that shift, I think we tried to demonstrate in previous report that shift in itself has had an impact on the KPIs and the performance then.
Councillor Maitland.
Thank you, Chairman. I am looking at the issue with respect to capital spending, and I'm particularly interested. I note that there's been a problem with Dalbeattie Day Centre, but I'm particularly interested about the social care and joint working systems being not implemented, and I wonder if anybody can help me with that. Unless I've misunderstood, this will be absolutely critical to what we agree with respect to social care and health integration, and I wonder if somebody could assist me with why that's not been moving forward as it should have.
Yes, I'll try. This is a carryover figure we've carried this over for the last couple of years, and it's been we've been enabled to do that in recognition of the need for further investment really in the system. So that's where it comes from. What the plan is this year is as we upgrade to Mosaic, that money will be used for that. So it's not specifically, the consideration this year is not specifically to look at it in terms of any developments around, say, integrated systems, or as we move forward with integration, how that might affect. That would probably be a completely different pot of money, I imagine, and probably a different sort of report coming through around what would be required. But it's about making sure that the framework I system that we have will be up to speed in terms of the upgrade. So that's how we were going to use that pot of money.
I may be being dim. I don't really completely understand because I presume it must have been allocated against a particular piece of work, and it's not clear to me why that piece of work wasn't done, Chairman.
Yes, originally, if I understood it right, originally it was allocated against the original development project for Framework I, and it wasn't spent at that point, and therefore it was held because we recognised that there probably would be further investments at some point, and we were allowed to carry it through. Now, at this point in time, with the upgrade to Mosaic, which is the next stage of Framework I, it's recognised that that's probably the most sensible way in which we could invest that money in terms of that upgrade. That upgrade will take us to an upgrade of the system itself, but it will also enable us to move to much more mobile working options for staff. So we'll be looking at, we're putting through in terms of capital bids around IT, options about how we might enable all of our staff to have mobile devices that they could use when they're out and about, and then they're able to come back in, they're able to sync that up with the system. So it's part and parcel of that overall development. The 55 that's noted here wouldn't be enough for all of that, but it certainly would help us to get the upgrade around Mosaic and any associated costs with that done. And then we'd look at the sort of the investment required for that shift to a mobile approach.
May I come back to that at the recommendations? I think we should. Thank you.
Councillor Scobie.
Yeah, Chair, could I return to a number of the issues that have been raised? Could I return to the one on homelessness on page 14, where it's reflected here as almost 3 times above our target figure. Could I ask on that one whether indeed the staff are fully trained and aware of the circumstances and the arrangements between social work and an RSL in terms of special cases, which frankly is quite a narrow band, but that notwithstanding housing and homeless is moving to another department, that social work are fully trained, and if not, what actions are being taken to make staff fully aware of the particular arrangements around the protocol between social work and the RSL. That would be my first question, Chair. Quite happy to have that, or will I move on?
I think we'll answer one question at a time and I'll allow you back in.
Okay, I think that there are a couple of different issues there. One is about the system and the recording, which we looked at, certainly prior to homelessness moving across to strategic housing. That was one of the issues about whether or not our system was able to record properly what was required. And we think part of that was what was impacting on this figure. In terms of whether or not staff are trained, we will have to revisit, given that we've moved homelessness across, our protocols to make sure that they're up to date. And if they're not, get them up to date and therefore put in whatever associated training would be required so that staff understand the relationship with homelessness now that it's sitting within strategic housing. That.
I'm not sure that actually answers the question. My own experience is that a great deal of staff are not aware of the protocol, how it operates in terms of homelessness, some of the issues around why and how a person can be put forward under the existing social work protocol, which will remain and maybe even be extended, is my understanding of that. And what I'm looking for is an assurance that staff will be made aware and trained on this particular protocol.
Thank you, Councillor, for that question. It's something that has been highlighted by some elected members in the last recent weeks, and it's something that I'll take back to Jim O'Neill and John Lynch to discuss further to ensure that staff are familiar with the protocol, and probably it also links maybe into Councillor McKee's point about our PDRs, and this is the type of information that should be captured in that as well. So I will take that further. That's okay.
Grateful for that, Chair. I think it's important, given the seminar we attended this week in terms of GARFIC and that housing should feature within GARFIC and the advice, the professional advice being given by social work on that one. So I would hope to see how that is developed. Can I turn to, Chair, the one on absence employees, and again that's almost double the figure. And there was an issue come up at the Health and Safety Subcommittee on this particular issue, and if we could have more narrative on this, whether indeed staff are suffering under stress, as a consequence of the number of cases that they deal with, casework and so forth and so on, whether indeed this is reflected in this particular figure, and what effect that has on the service that we deliver.
Okay, in terms of the absence figures themselves, there's a lot of work going on within the service and has been over the last sort of year and more with HR on a regular basis in terms of work with senior managers around understanding the absence figures and making sure that we understand what is behind them, and therefore looking at individual absences, again, to be able to have that dialogue with staff or their manager about what those issues might be. So there's currently a piece of work underway which is about making sure that with the HR we're having discussions with people's line manager to be able to understand whether or not there's something else that we need to do in relation to that in order to assist the figure to come down, but equally to make sure that we fully understand those very issues that you're raising. So it's an ongoing piece of work, and I suppose the issue might be about when we see that coming through on the KPI itself. Really, but there is a huge amount of work going on within the service. It's seen as a real priority in terms of the understanding that we need to have around the whole absence management arena.
I accept what Councillor Scobie has said there, but I'd also like to point out that even though social work figures are above the council figures, it's still an improving picture that over the last 3 years we have managed to reduce those sickness levels. But like my colleague has said, it's something that we've got to revisit all the time. And we do work hard at supporting our staff who are probably doing the most stressful job of any other council employees.
Chair, I'm not actually sure if I heard an answer in terms of the impact this is having on the service delivery, where only this week a service user went to Stranraer and there was no duty social worker for her to see. So, and I'm not saying that's down to sickness absence. What I'm saying is what the impact of absenteeism is having on our service in terms of the delivery.
I don't think it'd be appropriate to comment on any individual team. However, nobody has raised any issues with me about that we did not have any duty social workers on at any time. And it's one of our requirements and principles that we would have somebody on to meet a member of the public. So I would appreciate that if elected members have those concerns, that they bring them to me and I will sort them out as best I can. So thank you.
I take Sean's point and his advice in bringing that issue to him. If that is the case, what I was asking was the overall effect it was having on the service, and I would hope we could continue to get that reported. Could I return again to page 12, Chair, and the one under the reduction in the percentage of children looked after away from home who have had 3 or more placements, and I accept, Chair, that this KPI is based on 3 or more placements, and that's what will be reflected here. Could I ask, in that respect, in terms of kinship carers, in terms of the increase, and whether that's recorded anywhere, and that we are meeting our obligation to them, that we are making sure they are paid timiously for kinship carers.
This is something that has come up at the last 2 or 3 social work committees, and I have fed back that as soon as a kinship carer goes through the kinship care panel, that the process is started straight away to get them paid. Now, I've spoke to the team manager who's responsible for this, and she assures me that no kinship carers have raised issues with her about not getting paid straight after the Binta panel.
Councillor Tuckfield.
Thank you, Chair. Page 24 of 54, percentage of level 2 and 3 MAPA cases reviewed within required timescale. I have to say I'm extremely disappointed to see this. It's public protection, and we should be at 100%. But on the other hand, it's apparently not our fault. Are people not interested in attending these meetings? It appears that meetings being rearranged due to lack of attendance by agency, reviewers being late due to chair availability, reviewers being late due to Christmas holidays. Could I have an explanation and perhaps some understanding of what is being done to put this right?
Our understanding in terms of looking for the analysis of the performance around this has been about the difficulty in reaching the 100% performance is about the practicalities of managing some of the demands coming in through the service, and obviously the practicalities for other people who need to be at these meetings. I mean, it's very, certainly within social work, and I know within other partner agencies, attendance at MAPA, particularly MAPA level 3s, are seen as a real priority and something which needs to be given that level of attention. So for us, there's a question here about, is it realistic to have a target at 100%, where we know just from a practical point of view that there may always be something that might get in the way, or whether we maintain the 100% target, knowing that the priority, that's what the priority is, and therefore make sure that at every occasion where we fall below that or are not able to attend, we understand that and we get that fed back in through that system so that we're really clear that whatever the level of performance is, it's the highest possible it can be. It might slip just below the 100, but yes, we would expect it not to slip maybe as far as it would appear to have done in this. And holidays themselves shouldn't be a reason for that dip. So again, we're looking at better understanding that to make sure then that we're in a really good position to be able to discuss with MAPA around, actually, is this the right target to have? And do we need some further explanation in there about the pressures on staff in terms of being able to attend and what they are, really?
Chair, if I can just respond to that. That's perfectly acceptable. But what is not acceptable, that it does appear that we all have difficulties getting sometimes to committees, etc. And I wouldn't want that to be always a reason for not meeting the targets. Thank you.
Yes, I would agree. I think this is one that when we've looked at it, when the reports come through, we've very clearly said, actually, that we need further analysis on this. We need to understand this more, and therefore we need to be really clear about our target and our performance against it.
Councillor Syme.
Thanks, Chair. Just Barton looked after children. I'm quite pleased to see there's been an improvement on the percentage of looked after children leaving care who have entered education, training or employment. I know it's been a concern of mine and Councillor McKee's for some time and been mentioned many times in this committee. I hope that the figures that we get in November are still achieving that. And I know there's been certain initiatives and supports in place to improve this certain issue. Are these initiatives now ongoing? Are we still trying hard to make sure that these young people leaving care are getting opportunities?
Yes, my understanding is that we are. I mean, our expectation would be that we would both maintain and hopefully improve our performance further. We've seen that, being improved over the last couple of years. So there's nothing at the minute that would anticipate any sort of fall in that performance. So yes, everything else is still in line, and we await that figure sort of to see what that comparison is with the figure you've got today.
Councillor McKee.
It was along similar lines, but just on that, the question I would ask now, is our target high enough? Do we need to raise the target level?
I think it might be that when we come back with the 6th monthly report, that by that stage we'll have this year's figure, that might be a really useful opportunity to say, is the target, depending on the performance, but whether or not that's an appropriate time then to say we maybe could look at the target, because yes, we want to keep it as an achievable target, but also a target that stretches. So I think that would be more than, I can make sure that we include that in the report coming back for the 6-month report. Okay.
Councillor Ferguson.
Thanks, Chair. I'm actually drawing a comparison here between the child protection and the adult protection meetings, and I'm just questioning why there's a difference in the target for child protection as there is for adult protection. Are there moves afoot to actually rationalise the two to make sure that target is exactly the same for both adults and children?
Both these targets are under both KPIs are under current review, because we need to ensure we understand really clearly what we're trying to measure. And I think the consensus at the minute is that this is not quite getting us to what it is we need to measure in terms of whether or not we're keeping either children or adults safe. There's a major piece of work going on within the Children's Services Improvement Plan in relation to initial referral meetings, which would replace the strategy meeting one, and the consideration around the data work that's going on in children's services, looking at what would be the appropriate set of KPIs that would need to be in. So this we expect to be replaced with hopefully something which actually gives you a much better measure and allows you then to be able to see much clearer whether or not we're meeting that target. So the adult care one is slightly different in terms of how we're collecting the information. So we've been looking really clearly at that one to make sure that we're really clear about the timescales we use, where they fit in terms of the referral coming in, the inquiry and the investigation. So again, with the learning from Children's Services, we're again going back to look at that to say, what else might we need to look at there? Again, is this the right measure? We're not convinced that it is. And we would want to do some further work on that. So, those are probably, I think both of those indicators may well, it's certainly in the 6-month report coming back, in the same way about young people in employment, it may well be the time we want to come back and say, this is the outcome of our consideration of these. These are the suggestions we've got around perhaps a set of better measures for you that will actually give you something which is much more meaningful than what you've currently got.
Thanks, Heather, but not quite what I asked. I'm actually asking, are there plans afoot to rationalise, to ensure that adults who are at risk are covered within the same target time as children?
I'm not sure that it's as simple an answer as that, in the sense that we've got two different sets of procedures. These are two different pieces of work. The way in which you work with children, there are lots of similarities between working with children at risk and working with adults at risk, but there are also differences. And one of the key differences is about, as an adult, the whole issue about an adult's capacity and their ability to make decisions for themselves, and also within the procedures around adult support and protection for them to be able to say, actually, I don't want to progress with this. So we need to be mindful of those differences. So to move to a complete rationalisation, I think we need to be careful that what we don't do is lose the essence of what we're trying to achieve, both in terms of keeping children safe and in terms of keeping adults safe. So there's certainly a lot of work going on at the minute around what we do in terms of both, but I'm not sure that it will necessarily give you that complete rationalisation with these measures. I think it may be when we're developing the measures that we might be able to look at something that says, actually, well, could we look at a couple of measures that gives you that better comparison against the two? But we need to be really clear then what we're comparing, so that in terms of a child's experience and an adult's experience, we're really clear about the differences that there are, because they're not exactly the same. And we would need to be really careful and mindful of not trying to squeeze them into something the same, because we then potentially lose something really important about what it is that we're trying to measure.
If there are no other questions, can we move to recommendations? 2.1, review the overall summary of performance for social work services set out of Appendix 1.
Sorry, I was just looking at these recommendations and wondering where I might slip something in. I think probably it's at 2.
Sorry, could you repeat that? I didn't quite catch it.
I was looking to see where I might put something in about improving our integration, our performance with respect to technology, and making certain that comes back, because I don't want to lose that against the background of a care inspectorate for children's services which talked about integration and protocols, information sharing, use of IT, Framework I, and I don't want to lose sight of what we have learnt here about how we can improve performance with respect to the integration agenda. I want it to read across. In other words, what work we do here to improve performance should be noted and taken into account when we're dealing with the integration agenda. That's all I'm saying.
Basically what you're saying, Jane, is we need to recognise the use of technology in terms of the integration agenda, and we need to make sure this is reported back when we report back on KPIs, etc.
May I particularly say, though, with respect to the Community Health and Social Care Integration Programme, that's where we've got to point this learning out with respect to the agenda in the future, because the principles are that we should be dealing with integration, service users should see nothing, and so I want to be absolutely sure that we're dealing with these sorts of technological issues as a matter of urgency. It shouldn't be appearing as a slippage, which is what's happening here, unless I've misunderstood.
Suitable wording written down, Chairman.
Councillor Scobie, were you wanting back in?
Yeah, Chair, and just on the recommendations, again, I take it you're 2.1 and 2.2, scrutinise the, if that's where you are, scrutinise the exception reporting. It's really to seek or to include their recommendation for an early report on the absenteeism and the discussions that are going on between social work and HR, human resources, with an analytical explanation of how we're tackling that particular problem. That's one of my recommendations, Chair. The other one would be an update on the training programme of staff in terms of housing options, and the improvement to the social work DGHP protocol.
I would advise that in relation to the sickness absence, that should be a report that's encompassed in a HR report to full council and just not back to this committee.
Yeah, if we could come back on that, Chair, at the Health and Safety Committee, then it was there that it said it should come back to the Service Committee, and notwithstanding that it will be reported, as Sean is saying, to the full council, I think it should come back to this committee for it to look at in terms of how we are dealing with the issues, should it be stress, etc., and that we have an analytical view as to what the absenteeism is about in that respect. And we are dealing with the whole issue, not only of people going off, but people returning to work as well. So in that respect, you know, we've got one committee, the Health and Safety Subcommittee, saying it should come back to the Service Committee, that they don't have a locus in that, or they have an overview rather. And I think that it should be coming back to this committee for us, for our consideration. And again, I would ask for the second in terms of an update in the training on the housing options and the protocol.
And I think Heather Collington already said that we would be getting a full report back on this in November at the case.
We'll get the 6th monthly report back in November. We need to be clear about if we need a separate report specifically on sickness absence, or whether you want that included in the next performance report.
If I'm being asked, Chair, I would like it as a separate report.
Recommendation?
My advice, Chairman, would be that this is contained within the overall report rather than pick out pieces of the performance report and do separate reports. I think in terms of any operational information that can be given to members, that can be done out with the meeting But my advice is that we don't have separate reports on these issues. They're contained in the overall report back, 6-monthly report, and that's my advice.
Councillor Carruthers.
Thanks, Chairman. Just the point I picked up in earlier, just it was to come in at this point to see, and it was about actually the 6-monthly report. If we could see how social work services as a department compares with the rest across Scotland, and the reason I'm asking for that, Chairman, is so that I could then compare, because we're nearly 32, I think it's 33% in the red with our actual figures. Do you see how that compares against the rest of Scotland, so we can see if is the targets correct or the incorrect? Should we adjust them or should we not? So it's as much about that. So that's the point I would like to raise. If we could see that this Dumfries and Galloway in context across the whole of Scotland, but in broad terms, at the 6-monthly report as well, please, if that's possible.
Can I just have a piece of information? I mean, I would assume that I think it's all very laudable that we do this. Have we got an opportunity to do this in the refresh of the business plan? Is that where we would expect to revisit targets and look at consideration of performance information? I mean, I think it should be done, but let's not sort of, deviate from our current arrangements. I take advice on that. I think it's important, but let's keep it in a structure.
Yes, we have a seminar on the business plan refresh, which is next week. And part of that seminar will look at our performance in terms of the review back and therefore what we're putting into next year. We are hoping to go with minimal change in terms of it's the third year of the cycle, as it were, and the following year we'll see major change. But yes, that's where we can pick up and we can add in or we can make changes too. And so therefore I would hope that people would be able to attend that, because that's really important to have your views obviously in that, and we can then feed that in and that will then come back to committee in July.
Chairman, I wonder if I could just get confirmation, it's over here to your left. Do you want to get confirmation what Heather said there? What it sounded like she said, we'll have a seminar next week, and from that seminar we'll get information, the kind of information that I've certainly asked for, and that'll feed into the report in July. Just getting confirmation exactly what that means. If that's the case, I would retract what I've asked for.
Can we move to 2.2? Scrutinise the exception report that's in Appendix 2 and 3. I think we've done that. Great. Thank you. Move on to item 5. Yeah. And before we... Before we move on to that report, for those of you who don't know, Graham Breen's is here as our new head of adult services, and he will be taking part in this report, which will be presented by Matthew Healy.
Thank you, Chair. I'll maybe just take a few minutes to introduce the report, Chair, if you don't mind. As you noted there, before Graham came into post, this paper was actually written by John Patterson, who was our interim head of adult care, but as John's no longer here, I've been asked to present the report this morning. The paper basically pulls together a number of strands of work which are all being impacted by the integration agenda. Members will be aware that local integration arrangements have been in place initially by 1st of April 2015. That planning has been taken forward on a partnership basis, with recent discussions at the Community Health and Social Care Partnership Board at the end of last month. As we progress through this work, it does mean that more and more of what would traditionally have been seen as, in inverted commas, council business does require to be delivered on a partnership basis. And this report tries to pull together a number of those pieces of work. As regards the review of adult care, it's considered that further work is required to be taken forward as part of the integration agenda. The report also discusses arrangements around home care, where we continue to make arrangements to secure the long-term viability of this important market. We have in the last few days issued a tender inviting expressions of interest within the Nithsdale and Stewartry areas, and as discussed with committee previously, that piece of work is envisaged as a sort of a short to medium term solution whilst we plan for longer term, more strategic arrangements, and planning for those longer term arrangements is continuing. The report also touches on voluntary day centres, and members will recall previous discussions on those. As previously discussed with committee, work is progressing and information has been collected and is currently being analysed and will be reported back to committee in due course. Another piece of work that the report touches on is the implementation of the Self-Directed Support Act. This Act does represent a significant shift in practice and requires fairly fundamental changes to the way that we work. Full implementation of the Act has to be seen as a longer term project, but we're continuing to make developments in this work, building on our experience as a pilot test site. And finally, the report also discusses our work on the review of commissioning activity. That work has also been affected by the integration agenda and more recently by some staff changes, but I'm able to report to committee that work is complete. There's a draft report currently with managers, and it's proposed that the detail of that review is reported back to committee in August. So that's just a very brief run through, Chair, of a number of things that are within this report. Obviously very happy to try and take questions as members wish.
Councillor Dempster.
Thanks, Chair. It's an observation as much as a question about home care, and it's on page 44, 315, within the forthcoming tender, and you're talking about working with providers to be more specific in terms of where they feel they can most effectively provide service and allowing appropriate response to differing geographical challenges presented. Well, that's an issue that we certainly have in rural locations. And I mean, I can offer anecdotal evidence where we have assessed that people in need but have no capacity to provide that particular cover. And we talk as well about ensuring the consistency of approach, linking rationalisation to various rates applied by different providers. I hope, because we've talked this in the past, Sean, about different members of staff with different private providers being paid different rates. In fact, sometimes private providers working with the council, so you have two members of staff from different organisations with a single client being paid a different rate, and we were always looking to somehow persuade providers to at least come to a position where they would pay their staff their living wage. And I know it's nothing that we can control, but it's something we can try and negotiate with, and I hope that that's part of the negotiating process as we go through. So it's really not a question, it's mere an observation. I'm pleased that that particular element has been brought to members, and I would hope that the rationalisation of service does not impact on the rurality and doesn't leave members of the public without the necessary assistance that they need to continue to live in their own homes, and that the staff in rural locations are no prejudiced because of their location and paid a lower rate. I think that's unreasonable to continue in that fashion. So I don't really need a response unless there's one volunteered. It's an observation, and I would hope that will be a positive approach we'll take.
Councillor Carruthers.
Thanks, Chairman. Just it's on the day centres themselves, and looking at distribution at a local level, using each locality. I think each area, as in what area committees would, Andale, Eskdale, Nithsdale, Shooty and Wigtonshire. Just how will that work out? Will it, and funding proportionality as well? I'd like to get an understanding of how that will work, please.
I'm sorry, I never quite got the question just at the end. Sorry, Councillor.
No bother, no bother. Just it's day centres in general. We're looking at going down a different route of funding them. How will that work in regards to, will it be based on the proportionate funding that they've got at the moment, or will they be tendering? Will they come in and tender or be commissioned on a basis? Because we're looking at this as a whole package, just to get a full understanding of what's actually happening there, please.
I'm not sure that we currently have the answer for that, Councillor. I think that's one of the things that at present that we are looking at in terms of the current review work. You'll probably recall that when we discussed this before, the agreement of committee was that the previous funding arrangements would continue, and then that was subsequently augmented by a 2% increase in their overall funding package. But clearly, as we review the work of the individual centres and look at how they work within the overall framework of services offered, then I think the funding arrangements for them has to come into that discussion. But I don't know that we would have an answer to that question at present.
Is that the report coming back to Augustin, Chairman? Yep, it is. Okay.
Councillor Maitland.
Actually, it was exactly on that point, Chairman. I think that I think what we've got to be completely clear about it. There are two paragraphs, paragraph 3.12 and paragraph 3.24. I think we've got to be completely clear that the model that is being proposed, that we were told about yesterday, does not anticipate budgetary decisions being taken at an area level. And I think members have got to absolutely get that nailed as to whether it is, whether it isn't, what is actually going to happen. Because to suggest that the disaggregation would allow for decisions to be made on the best use of that resource at a locality level, I think is slightly confusing. I think what we are expecting to do is to look at the budgets, which I think Paul and Katie are looking at, and doing due diligence on what services are provided for what budget, and we need to look at the whole of the services in respect of an area provision. That's how it's going to be looked at. That's what I anticipate. But what's going here, what's coming through here, forgive me, I mean, I think it's work in progress. You know, you could say it's work in progress or it's a slight fudge, but we've got to be absolutely clear about what is and what is not doable at an area level. And my understanding is that you will not be taking budgetary decisions at an area level.
I don't actually think that there's been a final point. I think the point's well made about what's in, what's not in, and how this is going to be done. But I just like to emphasise, this is still, around about day centres, this is very much work in progress. The full review will need to come back with recommendations back to committee.
Chairman, I wonder if I could just ask, Jane made a valid point earlier, is this something that we could raise at the seminar on Monday as a matter, because it is coming, the decision was made, I'm sure that it was to come back for August, no later than, so I'd imagine the report in detail will be there then. Is this something we can raise points at the seminar on Monday for the sake of the report that's coming forward?
No, Councillor Currers, I don't think we could take this on Monday, because on Monday the seminar is around the social work business plan, and I think Councillor Maitland has made a very valid point about there's been very much work in progress, because it's what the challenge that we're facing now is the whole social work healthcare integration, and we've got to, anything review, we've got to review as a partner, and as you said, Councillor Maitland, that includes the finances as well. Now, I don't want to Councillor Maitland said fudge the answer, but there is a lot of unknowns out here as we move into that social work healthcare agenda, and this is probably one of them. and it's probably reflected in the report today. So.
Councillor Ferguson.
Thanks, Chair. I think we're getting mixed up with area committees and locality, because if you remember the seminar yesterday, those of us who were there, is the budgets will be devolved to the locality manager, right? That's what I mean, I would suggest by localities there, but obviously I'm not the report writer, and maybe Matthew can clear that up for us.
Yeah, I mean, I think as Sean said, there's, and Graham said as well, there's a lot of work still to be done here in exactly the detail of how this is going to work when we move into the integration agenda, and just the very specifics of where the money flows and how the reporting works, and, you know, our appetite for risk sharing between ourselves and the NHS and partnership bodies, etc., etc. There's a lot of detailed work which has to be done between now and then. So I think at this stage we probably know a lot of the questions, but I'm not sure that we necessarily have a lot of the answers. So I think these things need to be worked through between now and 1st of April.
Councillor McKee.
It was on, sorry. Self-directed support. Is there concerns there about different companies that people can go to charging different rates? And where do we stand with how much we're willing to pay, say, the hourly rate for services provided to these people? Because the way I see it at the present moment, there must be some control somewhere, but the way I see it at the present moment, some people could spend a lot more than others to get the same service. What sort of controls will be put in place for that?
I think one of the fundamental pieces of work that we're taking forward at the moment is the work, and it's sort of mentioned in the report, around the validation team, whereby we recognise the very risk that you've just identified, Councillor. And one of the things that we're trying to do is ensure that no matter how someone may or may not choose to have their needs met, that the financial burden on the council is equitable, and therefore if someone goes down an option 1, 2 or 3 route, that as a council, well, I suppose 2 things. One is that the individual's kept safe and their needs are met, but also that 2, as a council, our financial obligation is the same. I think you're right. There's a lot of complexity around this, and there are areas whereby an individual will take the budget that's assigned to them, if that's the option that they choose, and they will go and negotiate with other organisations on a sort of a private basis. And, you know, whilst we can guide some of that and we can put frameworks in place and so on, the underlying thrust of the legislation, it has to be that if an individual chooses to do that, then they have the right to do so. So I think what we're trying to do is put in place the arrangements whereby we're protected as a council, financially and also in our wider duties, that we protect the individuals as well. But that they do, through this legislation, have some more, in fact, quite a lot more choice than they previously had.
Any other questions from members? Then let's move to recommendations. Thank you. As you can see, I'm new to this job. 2.1. Agree that work on the review of adult care, including people with a learning disability, should now be taken forward with partners in the context of integration of health and social care. Okay. 2.2. Note the current position regarding tendering for elements of current home care provision, and agree future commissioning intentions in developing an integrated strategic plan. Noted. 2.3. Note the work in relation to the voluntary day centres for older people, and agree this work could also helpfully be taken forward in the context of locality planning. Noted. Note the progress made in implementing self-directed support, and a further report will be presented to Social Work Committee in autumn 2014, dealing on the next phase. Noted. Note the work carried out to date on reviews of commissioning, and agree the detail of the recommendation will be reported to the committee in August. Noted. Move to item 6, which is a Social Work Services Subcommittee minute. Great. Councillor Ferguson.
I see there's some getting circulated, Chair, but in the meantime, could we thank publicly Matthew for his work in the time he's been with us, because I'm not sure he'll be back for the next Social Work Committee if he's still going to be around. If he's not, right? Is it? If he is it?
Does Councillor Ferguson know something I don't know?
No. It's just if that was the case, I think we should record the hard work he's done in the time he's been here.
Thank you, Chair. I'd just like to say something to thank Councillor Andy Ferguson for his good work within the Social Work Service Committee as a chair, and he has worked for the Social Works Service Committee for the past 2 years. During his term as a chair, he thrived to improve the social work service performance, and he works tirelessly hard as a chair. He will be remembered for his hard work. Thank you.
I would be happy to endorse that view and give my personal thanks to Councillor Ferguson for the work that he has done over the past 2 years. Paper in front of you just now.
Chairman, may I just echo your comments, please? Thank you.
You have a paper in front of you which has been tabled. As you all know, we've had some difficulty recently, which has resulted in the loss of the chair of social work. At our last meeting, we agreed that the chair and the vice chair should go to the Association of Directors of Social Work annual conference. As a result of some of the difficulties we've had, Councillor Ferguson has resigned as chair, and it was agreed that the chair and the vice chair should go forward. I also find myself in difficulties in attending that meeting. And what I would like to do is to throw that open to the membership of the Social Work Committee to see if anybody would like to take up these places. Others?
I mean, my first thoughts come through. I think I would like to offer it to Andy Ferguson as the first option. He's not the chair now, but he's still a councillor here, and I think he would have good input. It obviously would be up to him to take that up or not.
Councillor Ferguson?
No, I don't think it would be apt if I did that, but thanks for the invitation, Ian. I actually think it would be a good opportunity for two members who have not experienced that environment before to actually go for the first time and actually see the ADSW conference in action. I tell you what, it'll open your eyes.
Councillor Maitland?
I absolutely agree with that, and I think it's a good idea if somebody hasn't been before. I actually have been before. I can't go this time, but I have been before. I would propose that Councillor Brodie is one of the people who might go.
Councillor McKay?
Councillor Crothers does a lot of talking. I was wondering if we could send his wife and he can do his own cooking for a couple of days.
I could certainly put it to her, Chair, if there's nobody else comes forward.
Agreed.
Councillor Brodie has been put forward as a nomination to attend that.
But we want a report from him.
Yes, absolutely. Councillor Ferguson?
In that case, I would also suggest that then, because the place is bought and paid for, I understand, then we offer it up to a senior officer to actually accompany the current team who are going. I don't think we can waste £400, I think it is, plus VAT. That could very usefully be used for a new senior member of staff or a second in command or something down those lines.
First of all, I would say that as officers we have identified the team that we feel is appropriate to go, but I would suggest that if we cannot fill the place within this committee, that is thrown open to the rest of the elected members, and then if we can't get somebody from there, we would offer to an officer. But I think it's important that what Councillor Ferguson has said, it's an eye-opener for council members, and really I would prefer that 2 councillors went.
Chair, with your leave, there is also the really unique opportunity to invite one of our partners from the NHS who are going to be absolutely integral, and I'm fairly certain a fair chunk of the agenda will be about integration.
Chair,
Councillor Dempster?
Thanks, Chair. You've got a proposal already, and that's absolutely fine. If Councillor Crothers wants to attend, that's it, fixed. And I think Sean McGlennan's opinion is wise. If any other council member, failing Karen, wanting to go, would like to attend to expand their knowledge, that's fine. And then if no, we can deal with whatever might cascade from that. But I think Sean's suggestion is a very sound one. If Councillor Crothers doesn't want to go, Councillor Karen Crothers doesn't want to go, then we can open it to other members.
I think that's probably appropriate, and I think if we can delegate that to...
Can I be totally clear? Who's proposed to go? I proposed Councillor Brodie goes. Where's that standing at the moment?
Yes, Councillor Brodie will be going.
That's agreed.
And what we're actually looking at is one other, and what I actually propose is that that's delegated back to Claire when Councillor Carruthers can consult with his wife, and if she's willing to go, then she should go. I have no further business. Thank you.
Chair, my hand's up, so before you'd finished.
Councillor Ferguson.
The main reason I actually withdrew this was to allow the new administration to send someone, and I'm actually very disappointed there's no one from the new administration who are actually prepared to go, and I think that needs to be recorded.
Chair, some of us have other meetings to go to that are important to this council, which is why we're not going. However, you could maybe go, Andy, or you're likely to go to the same meeting we're going to.